Okay. Dr. Morrison, are you ready to go? Everybody's ready? Okay. Good morning, everyone, and thank you for joining us. Of course, I have Dr. Morrison here with me to provide an overall COVID-19 update in the province and to provide some further guidance on some of the changes that we will be making as we work our way through COVID-19. The Chief Public Health Office, of course, continues to monitor the situation on PEI very closely. Last week, we entered step one of our reopening plan. And while we move forward cautiously, we are also doing so ensuring to all islanders that we're keeping a close eye on the virus in this province, and we're trying to balance that with our need to get everyone back to life in a somewhat normal fashion as soon as we can, and that continues to be our goal. Dr. Morrison and the Chief Public Health Office have made a number of recommendations to Cabinet on adjustments based on the shift in what we are seeing in our province and we continue to see. With this Omicron wave, we are seeing transmission occur in our province between both vaccinated and unvaccinated individuals. This is much different than what we have seen in every other aspect of the pandemic to date. During the previous waves, we have seen transmission primarily occur between unvaccinated individuals, and with the arrival of the Delta variant in October and its contagious nature, we introduced the PEI Vax Pass. The Vax Pass was always intended to be a time-limited measure, and that really did help us remain safe and help to significantly limit the transmission of the virus in the province. We also have the highest levels of vaccination in the country. In particular, 82% of those 50 and over have gotten their third shot booster, which is an incredible number, and almost 70% of those 18 and over are boosted as well, and those numbers continue to grow in the days ahead. As we move through the last stages of this pandemic, the requirement for PEI Vax Pass for discretionary activities will be removed effective February the 28th at 12:01 a.m. We still have many levels of protection within our borders. We continue to test all of those at our points of entry. We continue to have students and teachers and educational staff test 3 times a week with rapid tests. We still have our mandatory masking, and we still have capacity limits. In addition, as we have mentioned the last time we were here, we will also be making adjustments to the case contact management plan, and that will be effective as of 12:01 tomorrow. These changes are also based on what we are seeing with Omicron, where a high percentage of transmission occurs within households. And Dr. Morrison will have more information on how that will work in a moment. These are cautious and positive steps forward using the information we have gathered. And I've talked to Dr. Morrison about this. The information that we've gathered, we always use that term, but it's also the facts and realities that we have all been living with through this. It's been not without its challenges for sure, and we all want to move through this as quickly and as safely as we can. But we continue to remain very mindful of the Omicron COVID-19 virus, and in the days and weeks ahead, we will continue to adjust and make our way through this. I know when people hear changes such as the ones we're making today and we've made in the past, our immediate reaction is to open our eyes wide. And I think Dr. Morrison and I actually talked in the elevator on the way down that probably just has more to do with the fact that we've lived through this for as long as we have, and it's been such a drain on all of us that our scars and bruises get reopened or when we hear news like this. But we're in a good place. We're moving forward safely and carefully. We are seeing our indicators on a good trajectory, and that is allowing us to move to this to the extent that we are. So with that, I'll turn it over to Dr. Morrison for more information, and then we'll open it up to questions from our friends in the media. So over to you, Dr. Morrison.
Thank you, Premier. Good morning. And I agree, this is really positive announcements signaling that we are transitioning out of COVID-19, but transitioning is never easy for any of us. As a province and as a country, we are coming to that 2-year mark of the pandemic, and we are in a much better position today than we were in the pandemic or when the pandemic began in March of 2020. We have safe and effective vaccines. 97.1% of eligible Islanders aged 12 and over have 1 dose, almost 94% with 2 doses. 69% of children aged 5 to 11 have 1 dose. And as the Premier mentioned, out of those who are eligible for their booster vaccine, 50 years of age and older, overall 82% of them have received that booster. And also overall, for those who are eligible for a booster, 18 and over, 69%, so almost 70% have received that 3rd dose booster. We have treatments for COVID-19 now that reduce the potential of serious outcomes and hospitalization for those who are at highest risk. We know that public health measures work and provide important layers of protection, helping to minimize the harms associated with COVID-19. While we are all looking forward to continued easing of measures in the weeks ahead, it's important to note that as we transition to living with COVID, we will anticipate additional waves and outbreaks. The Omicron variant reminds us this virus will continue to evolve within Canada and globally. Although we feel the Omicron wave has likely peaked in PEI, with hospitalization numbers declining to low levels, our infection rates still remain high. The percentage of tests that are positive remains elevated but stable at 17%. The trends we are seeing in PEI are very similar to what is being experienced nationally. The pandemic is not over. COVID-19 will be with us for the foreseeable future. I think the Premier said it last week, we are not declaring victory, but rather we are adjusting how we live with this virus more sustainably. Going forward, we will continue to rely on important tools in our toolbox, including vaccines, treatments, public health measures, robust surveillance, and public health and healthcare infrastructure. As of 8 o'clock this morning, there are 526 new cases of COVID-19 to report, bringing our total active cases to 2,316. And that's since yesterday's reporting. Today's total number of new cases is high because the testing clinics were closed on Monday for Islander Day. Over the last 7 days, we've had an average of 244 cases a day. A total of 4 individuals are in hospital and are positive for COVID-19. 2 of these patients are in hospital being treated for COVID-19, while the remaining 2 were admitted for other reasons, being COVID-19 positive on admission or testing positive after admission. In terms of outbreaks in vulnerable settings are one of our indicators in our Moving On plan, and they are overall are down in terms of numbers. Currently, there are outbreaks in 2 long-term care facilities, Garden Home and South Shore Villa. There are no outbreaks in community care facilities. As of this morning, there are 18 early learning childcare centers impacted by COVID-19. 9 centers are open, 7 are open with modified or limited services, and 2 centers are closed. As we've continued to talk about for many months, our very best defense against COVID-19 in terms of severe outcomes is to be vaccinated, including a booster dose when eligible. Immunity following a vaccine is more robust than natural immunity acquired as the result of being infected with COVID-19. Receiving an mRNA booster offers superior protection compared to 2 doses, keeping more people out of hospital and preventing deaths. While we've had an overall good response to the COVID-19 vaccine in PEI, and we talked about our booster percentages, we still have room to improve booster dose coverage, especially in individuals who are age 50 and over and at higher risk of severe outcomes. Although a high proportion of island residents have had 2 doses of vaccine, there are almost 33,000 people age 18 and over who have 2 doses and are eligible but have not yet received their booster. And those are, and almost 11,000 of these individuals are age 50 and over. I urge all individuals who are eligible for their vaccine booster to please book an appointment soon. Last week, Health Canada authorized a new protein-based vaccine for use in Canada, the Novavax Nuvaoxovid, mouthful, for use in individual age 18 and over. The primary series consists of 2 doses given 8 weeks apart, or 3 doses for people who are moderately to severely immunocompromised. This vaccine provides a new option for individuals who are unable or unwilling to receive an mRNA vaccine. A small supply of the Novavax vaccine is expected to arrive in the province by the end of March. An update will be provided closer to that time regarding where individuals can access this vaccine. Youth aged 12 to 17 can now receive a Pfizer booster, even if they do not fall into one of the previously announced groups 6 months after their second dose. Families are encouraged to review information provided regarding what is known about booster doses in this age group, including the low risk of severe illness from COVID-19 and the rare risk of myocarditis and pericarditis following mRNA vaccines. As we mentioned at the last briefing, we are updating the definition of a close contact and eliminating the isolation requirements for some close contacts. These changes that come into effect tomorrow, February 24th, will reduce the impact, or really the restriction, of being identified as a close contact on many individuals and for island families. A close contact is someone who was within 2 meters or 6 feet with a positive case when they were infectious, 48 hours prior to symptoms starting or before testing positive if no symptoms. This means face-to-face interaction for at least 15 minutes, and that includes 15 minutes over a 24-hour period within 6 feet. If the person who tested positive was wearing a well-fitting 3-layer mask for the duration of the interaction, this is not a close contact situation. In terms of transmission between positive cases and contacts, we are seeing most transmission occurring within households or between individuals who live in the same household. So similar to other jurisdictions, going forward, there'll be 2 types of close contacts: household close contacts and non-household close contacts. A household close contact is someone who meets the definition of close contact and who spends time in the home of someone who tested positive for COVID-19 while that person was infectious. This includes any guests who stayed in the home. We talk about a child's friend who might have had a sleepover, or the babysitter who might be there all day. There's a range of these individuals who would be considered household close contacts. Household close contacts, regardless of their vaccine status, are required to isolate for 96 hours following their last contact with a positive case and get tested at a clinic on day 4 after exposure or sooner if symptoms develop. They can exit isolation with a negative test, provided they do not have symptoms, but they should not visit high-risk settings for 10 days following exposure to the positive case. High-risk settings include childcare facilities, long-term care homes, community care homes, group homes, and other congregate living settings. Staff who are identified as household close contacts can return to work in these settings, provided they wear a well-fitting mask and follow institutional protocols and have completed their isolation. Children can return to childcare facilities after completing their 4 days of isolation as a household contact. Non-household close contacts are other individuals who meet the definition of a close contact and may include classmates, busmates, teammates, work colleagues, or people you've had lunch with. Non-household close contacts, regardless of their vaccine status, are required to follow enhanced measures for 96 hours after their last exposure to the positive case. The enhanced measures include no isolation, get tested on day 4 at a testing clinic, wear proper fitting 3-layer mask when outside their home and as much as possible during physical and recreational activities. Work from home as much as possible. When at work, maintain physical distancing, and if symptoms develop, get tested, and do not wait until day 4. And similarly, for 10 days following their last exposure to a positive case, they should not visit high-risk settings. And that's very similar advice to what you mentioned for household close contacts. All close contacts, household and non-household, will continue to be contacted directly by positive cases, with the exception of school-aged children under the age of 12. Schools and childcare will assist with notifying these close contacts. We are aware of family situations where children and parents and guardians test positive at different times, often resulting in extended periods of isolation. In these situations, after completing the isolation for the first case as household contacts, family members who do not have symptoms and did not test positive may exit isolation and test every 4 days until the last positive case in the household has finished their isolation. And this may get complicated for everyone, but this will be outlined as well on the website. And the one additional change relates to individuals who are isolating with positive cases. For example, a parent or guardian isolating with a child who is positive for COVID-19. And these individuals no longer have to self-isolate as close contacts once the case recovers. And one last point, the changes I just mentioned all refer to close contacts, but there are no changes to the isolation requirements for positive cases of COVID-19 who are still required to isolate for 7 days for people who are fully vaccinated and 10 days for individuals who are not fully vaccinated. And there is still a difference because it appears that the period of infectiousness for vaccinated cases is shorter due to really the immune system being primed as a result of immunization. And I appreciate that this is a lot of information to take in, and there will be up-to-date information posted on the website later today. And if you do not find information to address your specific situation, please call 1-800-958-6400 or email dhw@gov.pe.ca for assistance. The PEI VaxPass program was implemented in early October during the peak of the Delta-driven wave of COVID-19 in Canada. It was a time-limited measure that provided an extra layer of protection, allowing more people to gather safely while reducing the risk of outbreaks and associated hospitalizations. Since the VaxPass was implemented, PEI has achieved an even higher rate of vaccination among those aged 12 and over, and the number of children aged 5 to 11 who are vaccinated is increasing each day. We know that vaccines are effective in reducing serious illness and hospitalizations related to COVID-19 and its variants. Although Omicron is less severe overall than earlier strains, it can still cause severe disease, particularly among unvaccinated individuals. Importantly, we also have treatments that reduce the potential of serious outcomes and hospitalization among those at highest risk. The VaxPass has been an effective tool in reducing transmission. However, with Omicron, we are now seeing COVID-19 transmission occur among vaccinated and unvaccinated individuals. And the main difference really is between vaccinated and unvaccinated is the risk of severe illness and outcomes, including hospitalizations. So as we transition to living with COVID-19 and in keeping with the changes announced in contact management, the PEI VaxPass, as the Premier mentioned, will be discontinued February 28th. And also, February 28th, travelers entering PEI who are not fully vaccinated will no longer be required to isolate. They will be required to be screened and tested on entry, and again on day 2 and 4, as all travelers, using their rapid antigen screening tests. Going forward, vaccines will continue to be a cornerstone of how we can protect ourselves and others. As this virus continues to evolve, so will our immunity and vaccine recommendations. As I mentioned at the outset, the changes announced today are not a signal that COVID-19 is fully behind us. Rather, we are taking steps to allow us to live sustainably with this virus. We will continue to be cautious and maintain a state of readiness as we achieve a balanced approach to managing COVID-19. In particular, we will place priority on continuing to protect the most vulnerable. Although a resurgence is still possible, we should be optimistic. We have a high rate of immunity in the population, which lowers our overall risk of serious outcomes. We know what public health measures work, and we have treatments for those at higher risk of serious outcomes. If we have to respond to ongoing waves, we will take the least restrictive measures. And what will public health be doing to remain ready? It will be to conduct ongoing disease surveillance, update vaccine recommendations, detect and manage outbreaks in long-term care homes, community care homes, and other congregate living settings, implement infection control guidelines based on individual risk and local epidemiology. And what can we do as individuals to keep this virus in check? Get vaccinated, including our booster, and think about our own risks before going out and make informed decisions. Follow the public health measures and stay home when we are sick. And as we look forward to living more normally with COVID-19, and I think I have to remind myself and the team of this almost more every day, as we get into this 2-year mark, we need to continue to be patient and kind. So, thank you.
Thank you very much, Dr. Morrison. So we will turn it over to questions from, I forget who I started with last time, so I'll maybe go to Brittany from CBC first. How about that? Okay.
Thank you. So my first question is around the changes on the 28th. So PEI Vax Pass will no longer be in effect, and unvaccinated travelers will no longer have to isolate. I'm just wondering, these were steps that were going to be taken in sort of the last phase of our reopening or moving on plan. Why the decision to bump these up so much sooner?
Well, I think they were in the second phase is when we indicated that we would be looking at it. But I think we indicated from the beginning that we would be looking to ease our way out of some of these measures, including those which were all time limited, but the Vax Pass in particular was time limited. I think I'll let Dr. Morrison answer from a technical perspective, but I think CPHO go back and look at the mandates and review the information on a very regular basis. Nobody wants these mandates to be in place any longer than they need to be. I think when we look at the science, we now have almost 2 months or a little more of Omicron. So we have information from right here in PEI that we've never had in this phase and in other phases of the pandemic, because we've largely did a good job of keeping COVID outside of the province. So I think we have more information at our disposal from a provincial level on Omicron, and I think they just review these things on a regular basis. But Dr. Morrison, I know Dr. Morrison and I talk about all of the mandates on a very regular basis, and we ask ourselves, what is the science behind it? How long do they need to be in place? So it's a regular conversation, and I can only assume that happens at the CPHO table.
I agree. I think we are always trying to reduce measures and keep the ones in place that are going to be the most effective. So it's always trying to balance and how this impacts different people. Our contact management changes even today are a change that may actually increase some cases, because people aren't going to be isolating all close contacts. But we try to do that knowing that we really think it's important to have children in class as much as possible, that they continue to participate in their activities. And so you're trying to balance some of that risk. And someone said to me this morning, it's really hard to remove some of these many layers of safety blankets in many ways. But we have to try to we are not going to get down to zero risk, and that's why we're really trying to move to some of that personal risk. And so we are going to try to make the best adjustments as we go forward. And I think, and I'm not sure if you signaled this too, if we're able to move up phase 2 and phase 3, even all together, we'll be looking at that, and we are looking at that as well, if we can adjust. I think it'll be important, though, to see what some of the changes that we have talked about last week and with close contact management, what those do for some of our indicators in the next couple of weeks.
And just to follow up, one of the questions I I often say this to you, the questions the media ask us are questions I regularly ask to Dr. Morrison and others, and maybe it's the former journalist in me, I don't know. But, in terms of what would the increased risk be, I think we would see more cases pop up potentially because of changes we're making to close contacts as opposed to the removal of the Vax Pass because of the other measures that we have in place. And that's one of the things that we measure as well. So, yeah.
And I'm curious to know, I guess, what has changed since the last announcement of what measures would be lifted and when to make you want to lift these measures? Because I know, we're seeing the number of new cases today, which is higher because of the holiday and everything. But I'm just wondering what specifically has changed to make you want to lift things sooner than originally planned.
Well, I think, Brittany, the Premier sort of answered that as well, that we continue to look at all these measures and what is the most, what measures can we keep in place to keep people as safe as possible? What do we need to adjust? The Vax Pass, we said right from the beginning, I think came into place in early October, as part of that Delta-driven fourth wave, and it has done a great job at trying to protect Islanders in terms of limiting transmission. But we're dealing with something that's different now with Omicron. We have our own experience here within the province of dealing with Omicron, and I think we need to focus on other measures to help us do that as we transition out of COVID, or transition to living with it in a different way.
And now, I guess, what do you expect the impact on testing capacity and our healthcare facilities to be when we lift restrictions? I know that, you've always said that as we lift restrictions, we're going to see more cases, and that's just how it works. But I'm just wondering what you think the impact will be in this case.
Well, I mean, we looked at the national modeling also came out at the end of last week, which certainly indicates across the country increase in cases with the lifting or easing of public health measures. But what's optimistic about it, it does not appear that the hospitalizations will increase to the same level. And I think, so that's a very positive sign. And so we're really trying to, and we've talked about it here before, how important it is to monitor severe outcomes and hospitalizations and our outbreaks in vulnerable settings. So we'll be watching that very closely, including the severe outcomes with younger people.
And look, one of the things that we talk about quite regularly is that when we announced the back to school plan, for example, with the testing, we indicated at that time that we expected to see an increase in the level of cases because 20,000 students and staff were going to be congregating on a regular basis. And I think what we're seeing in a lot of the numbers in the last couple of weeks in particular is that a large number of the positive cases that we had are in the younger population. And for the most part, that population has been not as risk adverse to the severe outcomes. Now, my son had COVID in the last couple of weeks, and for 24 to 36 hours was quite sick. So I don't want to diminish those who might be home saying, well, the Premier's saying you don't get sick, and I'm quite sick, but to the level requiring more severe outcomes or hospitalization seems to be considerably less. And Dr. Morrison and I talk about that a lot within that age group of population. So that's something we monitor also as well. But I mean, as we loosen some of these restrictions, we do so in knowing that it might have an increase in the overall case count. But as we said when we began our way out of this, is that the daily number of case counts is only one factor compared to what makes up, the other factors of the case counts as well. So it's a fine line that we're obviously trying to walk, and we monitor all of those numbers each and every day. But the fact that I think it was there's 2 hospitalizations. Is that the number that we announced today? So that's been on a pretty significant regular downward trajectory, which is a really good factor for us and gives CPHO and me confidence to continue to increment these minor changes.
And now maybe can we get into some of those indicators or some of the specific data that is sort of behind this decision to lift these restrictions sooner? I know you mentioned hospitalizations, but I guess what's the other?
So I think we presented some of the indicators. I think in previous, we've talked about them at some of the previous press releases. We've talked about cases being one indicator, but also hospitalizations, and that really has had a significant decreasing trend. We look at percent positivity as another one. We've talked about that. We talk about our vaccination rate. We look at our percent positivity, even at our points of entry. I think we track a whole bunch of them all the time since the beginning of the pandemic in terms of how many capacity, PPE, et cetera. But those would be the ones that we've presented here with our modeling. I think there were sort of 7 big indicators, and we talked and presented again late last time about 3 of them at least. So I think it's all adjustments, and we're also watching what's happening in other our provinces next door as well. That always influences what happens here.
And I'm actually just wondering too, when it comes to isolation for close contacts, I know you went over it just then, but could you possibly clarify just one more time how that's changing now for household contacts?
So up until tomorrow, close contacts, the definition of close contacts. So someone who you've been without a mask within 6 feet of each other, will be up to 15 minutes, and that's cumulative over a day or one day. So that is the definition of a close contact. So it's changed from 10 minutes to 15 minutes. That's really the change in terms of close contacts. But the change, Brittany, is between identifying household close contacts and non-household close contacts. And the reason we're doing that is that one of the things that we're able to do, because we have someone calling every single case of COVID, that we now can tell that the majority of our cases are related to household close contacts. Not all, but the majority. So that's where the importance of making sure they isolate. We do accept some more risk by having the non-household close contacts not isolate and monitor for symptoms, but we recognize that a lot of these were impacting particularly young people, and trying to keep them in school as much as possible and with the recreational activities with the other measures in place and the testing. So that's really the distinction of trying to minimize how many people have to isolate, and recognizing where the risk is. Ultimately, we will be not isolating anyone except the case. If you're sick, you stay home. That's where it's going to go, so we'll get there, but not yet.
We've all had the people who have contacted certainly my office or me, and maybe we all know that there are individuals who have been in almost a perpetual isolation for 4 or 5 weeks as a close contact of individuals who haven't contracted the virus, who aren't sick, but aren't able to go to school or aren't able to do certain things. So I think there is that, understanding and trying to find out how we can, as safely as possible, allow that next step to happen, as Dr. Morrison says, and then as we phase our way into that, we never want anyone, if they're sick, to go to work or school or anywhere. We'd like you to stay home. And that's whether you have COVID or influenza or a number of different, of other diseases as well. So that will be the goal of where we get to, but this is just the next phase of trying to make sure that this doesn't become a full-out pandemic of absenteeism based on, those needing to isolate for maybe reasons that, don't require them to. So, yeah.
All right. Thank you so much.
Thank you. Allison from The Guardian? Yeah.
Yes, hello. I have a question about the transmission between vaccinated and unvaccinated people. It sounds like that factored in quite a bit to this decision and the moving forward plan. Just wondering if you could elaborate on that.
So, we have continued to learn, Alison, about COVID and the virus, and each strain of the virus throughout the pandemic. And we've talked about it here before too, that Omicron really has been quite different than some of the previous strains. And we have, so our knowledge about the strains, but our knowledge around some infection prevention control practices, the importance of masks, that's evolved through the pandemic. And so this is one more where we've learned more about the transmission that seems to be able to, people who are vaccinated are getting COVID. They're not getting the same kind of severe outcomes overall, and which is really key. So it's trying to talk about the vaccines is really trying to protect yourself from severe outcomes. And that's a little bit of a change from where we have talked previously about the transmission between vaccinated and unvaccinated a little differently. But at the heart of it, though, is that we have high vaccination rates here, which will prevent us from severe outcomes. We do know that the other measures that we also have in place that are real important layers, we need to continue to do. As we all try to make sure that we look after each other, and we don't want our system overwhelmed, not because the hospital won't be able to cope with X number of hospitalizations of COVID, but we also don't want to have them to stop providing other services for us that are also needed.
Okay. So I see that masks are still, they're still the thing to do. They're still one of the layers. I had a conversation with someone on the weekend that said masks should be done with, that the virus is too small to get caught in the mask. Can we go back to the basics here and talk about how masks are protecting against Omicron and the virus generally and respiratory droplets?
I mean, I think we have so much more evidence around how the masks can help us but it has to be a good fitting mask. We've talked here and we've updated information on the website about well-fitting masks, the use of medical masks, 3-layer masks, and some of it also has to do about where you're working. For instance, a lot of our healthcare workers also using eye protection as well as masks. So I think they will be something that will be important for us to think about, and important for us to think about in certain settings well after some of the other measures have been eased up. And I would anticipate that masks for visitors in certain places will continue. And they may also continue during certain seasons for a long time to come.
And I wanted to jump ahead to the bridge this weekend. There's some activity planned there, and it seems to be targeting the testing station. There's a bit of a demonstration planned, and just wanting to ask about safety measures for staff at the testing stations coming up this weekend.
Well, I guess I'll take that question. I've also heard that there might be a gathering of some people in the Borden-Carleton area. I would encourage those, if they are still planning to do so, peacefully and democratically, which is their right, and I support them to do that. But they will not be able to disrupt the flow of goods and services on our critical infrastructure like the Confederation Bridge. And we have our policing authorities and working with our federal authorities through Transport Canada, we have responsibility for the Confederation Bridge to make sure their disruption plans that they have every day are ready to be enacted, and we continue to do that. Police, as I understand and have been informed through briefings, are talking with those organizers to let them know what is going on. They might, if they might be in sight line of the testing and border area, but they will not be in there. But we will take all the precaution that we can for our staff. I mean, such incredible undertaking by the staff over the last almost 2 years in doing something no one ever thought we needed to do. And like 99% of those who've come through have been so kind and understanding and patient, and there's been obviously isolated incidents of individuals who took out some frustration on those who are just doing their jobs, and I wish they wouldn't think of doing that there, and I hope that people would be respectful if they gather. But as we indicate here today, that some of the mandates that individuals have been frustrated with are slowly disappearing. We want to get back to normal as soon as we possibly can when it's safe to do so. Contrary to what some people might think or have been sharing their thoughts on, neither Dr. Morrison or I or anybody in government wants to have mandates in place that cause societal disruption and division. That's the last thing we want to do. But the reality remains that we have lived through a worldwide pandemic that has, caused a lot of sickness, and caused us to lose a lot of Canadians and 15 islanders, and that's not something we can take lightly here. So we're trying to move our way through this as safely and as quickly as possible. But I just ask those who have shown tremendous restraint so far with their protests and words to do so democratically. But I don't think they need to do it simply because we're trying to get through this as quickly as possible.
So, and I mean, I just think the staff that we have at the points of entry who have worked hard and 24 hours a day, sometimes in terrible weather, and they've been doing it doing their jobs to try to protect islanders. They've, identified lots of positive cases of COVID and minimized the transmission here throughout the pandemic. And PEI has, done so well throughout this pandemic, overall, and it's because we're all living through a history, including in this province, and I think it's just unfortunate if the folks that are working there at the bridge are the target of any frustrations, as the Premier mentioned. And and sort of Mother Bear would like to come up and I feel bad I feel badly if anyone is treated without the respect that they should have.
Thank you very much.
You're welcome.
Weird times, so thank you for your words.
Thank you, Alison. Thank you. We have some online media, I'm sure. I'll turn it over there.
Louise Martin, CBC. Oh, hi, and good afternoon to you both, or actually still good morning. So these are sweeping changes. This is, from the reaction I'm seeing, early reaction as people are caught off guard. Was it specifically the lack of large numbers of severe outcomes? Was that the main factor in making these changes now?
So, hi, Louise. So I guess we've outlined changes last week that were, fairly big changes. No isolation, for instance, at the point of entry, increased gathering numbers. We have other, changes that are coming in a couple of weeks and over the next few weeks. And we had always indicated that there would be changes in terms of our easing up on the Vax Pass. So I don't... And it's always a challenge because we're looking at it every day and looking at the information and why things were put in place. What can we keep in place that will still protect us the most as we try to transition to living with COVID? And so I think it's why we put the Vax Pass in. We've talked about it. It was going to be time limited, and it has been very effective and protecting islanders. But we're trying. We don't want to keep measures in place longer than needed, and so this is why this one was going to be lifted at the beginning of next week.
And close contacts, I mean, we talked last week about coming out with more detail on that, so I can't imagine anyone thinks that would come out of left field. But look, it's part of the overall movement to get past and through this. I mean, I think we've tried to indicate that to the best extent we can. We're doing a very good job of monitoring this on a daily basis, and the indicators are in the right direction, and we need to continue to monitor that information, and we use that information to inform our decisions, as we've always have, and until such time as this is over, that's what we will use the information to make the decisions, and I feel we've been pretty consistent on that from the beginning.
Yeah, I think people were expecting changes to close contacts. I think the Vax Pass and the no isolation for unvaccinated coming to PEI is, in fact, I'm reading the reactions now, is catching people off guard. So, I asked about, was it the severe outcome data that is really driving this decision? I don't think I got a clear answer, but, we often talk about hospitalizations as a lagging indicator. So the numbers are still in the hundreds of cases. So are you worried about an increase in severe outcomes and hospitalizations in a couple weeks' time?
Louise, I think I'm always worried. I told our epidemiologist I feel like I'm living in a perpetual state of anxiety, but because we are always concerned about this. But everything we are learning about Omicron, everything that we're seeing about Omicron at this point, it appears that we've passed the biggest peak in terms of our numbers here, and including the biggest peak of hospitalizations. We know it's a lagging indicator, and that's why we continue to follow severe outcomes very, very closely. And that's why the measures that we have in place, everything from testing at the point of entry, testing to our school children, masking, capacity limits, gathering limits, those are all still in place. That has not changed, and we will continue to look carefully at what will happen in the weeks ahead. But we also are very conscious of not wanting to keep measures in place that for longer than is necessary. And I don't know.
Yeah,
if you
and
wanna
I would
add.
just add that while I'm not on social media, and I would recommend everyone who wants to improve their mental health to do the same, I'm sure that every time we've made decisions in this format that there has been a reaction on social media, so I wouldn't expect that to be any different this time or the next time when we move forward. But we don't let that inform our decisions. I mean, we have pretty significant science over the last 2 months, right, particularly from PEI, but also from the region and across the country and beyond, that are helping us inform these decisions, and that's what we use. And I think that I'm pretty sure, knowing what I know, that tomorrow something will happen and there will be a reaction on social media to that as well. I'm just not sure what it is yet.
The other thing is, Louise, I mean, we talked about boosters being so important. I mean, the fact that we have 82% of those eligible who are 50 years of age and older who have that booster is really is certainly really important in terms of protecting those who may be at risk of severe outcomes. We've talked about our access through my comments to the antivirals that we have now that we didn't have 2 months ago. And when we look at even in terms of the rates of those who are in their 80s who have such a high rate of uptake in terms of their vaccine, that we have for 91% of those 80 and over have their booster. 85% of those in their 70s have their booster. So those are really good percentage of uptake for our boosters. So those also are part of what we look at. We talk about I think we talked to Brittany about the different indicators. So those kind of vaccine rates in our boosters also, as well as our severe outcomes and hospitalizations, continue to be things that we monitor closely and then would adjust our measures appropriately.
Thank you. And I have a question about testing, Dr. Morrison. We've heard from a number of people who were testing positive on rapid tests, for a week before a PCR came, or I guess molecular-based test came back positive. And I've also heard the opposite, a positive molecular test and a negative rapid test. There seems to be a lot of discrepancies between those two types of tests and the results that come back, and it's becoming quite confusing for people who don't know if they should be isolating or not. Can you address some of the discrepancies in testing between the clinic-based and the molecular-based and the rapid antigen at-home test?
So I think the first thing is, regardless of any test result, and no, there's no test that's 100%. If you're sick, you should stay home. And so I think that, as we've talked about that for almost 2 years. If you have symptoms, you should stay home. We've talked also about the fact that rapid antigen tests do not have the same sensitivity as your molecular-based testing or PCR tests, and that's why we say repeated tests are help improve that sensitivity. Now, one of the things that we're continuing to monitor too is the positivity is influenced by the prevalence in the community. So we look at that, and we were talking about that with the EPIs, looking at the testing result yesterday. So it is influenced by the prevalence in the community, but if you were going to choose, I trust the molecular tests more than the antigen tests. But if I don't have a molecular test, repeated antigen tests, serial antigen tests are the other option, and that's why we're using it for schools. But it's also very important that you stay home and you get tested with a molecular test if you're symptomatic.
In this particular case, sorry to just ask again, because I've heard this from a number of people, these were a series of positive rapid antigen tests, asymptomatic, and then a week later, a positive test at the clinic. So even right after taking a number of positive rapid tests, it was still a negative test at the clinic before another week, and then a positive test. Am I making sense?
Well, I mean, I think, Louise, will always, when you think of how many thousands of tests are done in this province every week, there'll always be an exception about why, for some reason, and it has to do with how the test was taken. Sometimes there's nares, sometimes there's mid-turbinate, there's a nasopharyngeal tests that are all done either on molecular tests or PCR. I think I can't speak to why it didn't. You may have heard from one person who had that experience, but I think in general, I'm glad you asked the question to clarify. The molecular-based test has a higher sensitivity than the antigen tests. Neither one of them is 100%, and that's why if you're symptomatic, it's really important to stay home.
And we're swabbing, you're recommending swabbing the throat now for the rapid antigen?
So we did put that information out there for that you can use a combination of nasal and throat, so not just throat, but nasal and throat on the antigen test, which may increase the sensitivity of it. And they did that study out of Nova Scotia. But frankly, there's some compliance. I'm not sure if you've tried to do a throat and a nasal swab together on a small child, but there's sometimes some resistance because if you do it once, you may not be able to get it done again. So you have to do what's reasonable too, and it may not apply for everyone, but that certainly we've given it as an option, and that those instructions are available online.
Yes, that is a very good point about compliance. Thanks very much. I appreciate it.
You're welcome.
Gabrielle Drummond, Radio Canada. Good morning to you both. Ma question en français pour la Dr. Morrison. Dr. Morrison, vous l'avez dit en anglais, mais j'aimerais l'entendre en français. Alors, pourquoi vous vous sentez assez confiante aujourd'hui pour dévancer cette étape du plan de déconfinement, c'est-à-dire d'enlever le laissez-passer vaccinal même si vous savez que le nombre de personnes qui subissent le dépistage augmente, le nombre d'hospitalisations aussi devrait augmenter. Alors pourquoi vous vous sentez assez confiante aujourd'hui pour faire ce changement-là?
Bonjour Gabrielle. Alors, je ne sais pas si le mot est confiant, mais tout à fait. Mais on regarde le nombre de personnes le nombre de personnes à l'hôpital. On regarde le nombre de personnes qui sont vaccinées avec le booster ici à l'île du Prince-Édouard. On regarde le nombre de personnes en général qui sont vaccinées ici. On regarde aussi le nombre de les outbreaks qu'on a, ça descend. Et puis, on ne sait plus à propos de Omicron et la transmission qui arrive. Alors, c'est le moment de la semaine prochaine d'avancer, d'enlever les passes vaccinales. Mais on va continuer de regarder toutes ces indications et j'espère que c'est une autre indication, un autre pas qu'on fait ensemble pour vivre avec COVID.
Et on sait qu'on a eu des manifestations ici à l'île du Prince-Édouard contre les mesures sanitaires. Très récemment ici, on a eu un convoi aussi des gens qui étaient contre le laissez-passer vaccinal, par exemple. Est-ce que ces manifestations-là ont d'une certaine façon influencé votre décision d'alléger les restrictions maintenant?
Tu veux... Gabrielle, c'est vraiment, on sait vraiment depuis le début de COVID, la pandémie globale, il y avait vraiment toujours des manifestations de personnes qui ne sont pas contentes. Alors, on ne fait pas les décisions à cause de ça. On regarde le but en ce cas, les passes vaccinales. On regarde les indications, le niveau de vaccination ici, le nombre d'hospitalisations. Alors, il faut... mais en même temps, on sait qu'il y en a beaucoup de personnes plus de personnes qui sont pas contentes, mais on ne fait pas les décisions pour faire les personnes qui sont de satisfaire des autres, mais on fait pour protéger le plus grand nombre avec le moins d'impact possible.
OK, parfait. Donc, ma prochaine question, peut-être for the minister, the Premier, Dennis King. So maybe I should repeat this question for you, Minister. I was asking Dr. Morrison about the protests that we have seen here on the island. So I would like to know, did the protests have any influence on the decision today to ease these restrictions?
Look, thanks. I appreciate the question. And the answer is no. Everything that has informed our decision has been the health and science and the information provided to me by recommendation from Dr. Morrison and the CPHO staff. And that has been consistent from the very beginning, and I have committed to all islanders that is the process we will use until we can find our way through this. And I very much appreciate that there are many people around Prince Edward Island who have varying views and difference of views, and I respect very much their right to voice those in a democratic way. But it has not once informed any of these decisions, and it will not inform any of these decisions. I've tried to take the best health guidance that I could provide from Dr. Morrison, and I'm grateful that we have done a very, very good job in this province with the whole almost 2-year journey of COVID, and I think that is in no short order because we've taken that advice and we've applied it consistently from day one, and that continues today.
Thank you very much. Dr. Morrison, juste une autre question. Ça serait concernant le fait que vous anticipez aujourd'hui la levée de certaines restrictions sanitaires pour la population en général. Est-ce qu'on pourrait s'attendre aussi à avoir une levée des mesures sanitaires dans les écoles plus rapidement à la fin de l'année scolaire?
J'imagine que les mesures qui sont dans les écoles vont être enlevées au même temps et avancées au même temps que les mesures dans la population générale. Et on imagine que ça va être mis en place avec notre Moving On Plan.
OK, très bien. Alors, merci beaucoup.
OK, merci.
Well, thank you all very much, and Dr. Morrison as well, thank you, and to all Islanders, enjoy the rest of the day.